Yeah, so there's always like difficult medical cases, but the cases that I really find interesting are the ones where they sort of take into consideration social determinants of health, right? So in Buffalo and even now in Canada, I've chose to work in high needs areas. When I was in Buffalo, I was working at a federally qualified health center, and in Canada, I work in downtown Toronto, but then also my main clinic is in a high needs area. And the interesting thing about working with those populations is they don't always have a lot of money. Sometimes transportation is an issue. And so those have been challenging to me because you have to sort of take it in consideration. Can they afford the medication? You know, and if they can't, what other options do we have? Because when it comes to finances and medical care, especially if they don't have ODSP, which is, you know, our Ontario drug plan, and they will have to pay for it out of pocket. And so if they have to pay a lot of money for it, they're probably not going to adhere to the treatment protocol, especially for chronic conditions like diabetes and high blood pressure, high cholesterol, or patients with, you know, heart problems. So that's one of the issues that I find difficult on a regular basis. Another issue is you're thinking about language barriers. In a lot of these high needs areas, there's patients that, you know, English is not their first language. And so you sort of have to find a way to not speak medical jargon and get them to understand things in their language, and also taking into consideration their culture as well. Every culture is so different too, right? And how they interpret medicine. And so, you know, especially when you have a patient that's on 6, 7 medications and you're trying to explain it to them in their language and administration and dosing, especially for adding on other medications, that becomes challenging as well. And now with the COVID pandemic, a lot of doctors' offices weren't initially open. So a lot of those patients were actually going to different walk-in clinics or using virtual platforms. And that made it even more confusing because the patients didn't know what meds they were on. And unfortunately, in Ontario, our electronic medical records are not integrated. And so trying to figure out what meds were they taking, we don't want to make any mistakes, you know, with polypharmacy, any drug interactions and things like that. So on a regular basis, those have been like my more challenging cases, but also, I mean, the most rewarding, especially when the patient walks out and they completely understand what is going on with their health.